Hi, Dr. Regina Rodman here. We are going to go over today some of the most common risks that happen with a rhinoplasty. Now, when you come to our office at your pre-op, we give you this big folder and it's full of a ton of papers. There's a lot of things listed that sound terrible and scary. There are several things on this that it is our job to tell you about. It's our job to make you aware of. As part of informed consent, we are supposed to tell you anything that could possibly happen that would be a devastating kind of a consequence. But a lot of that stuff, you are more likely to get hit by a bus on your way to surgery than to have that thing go wrong. So what I want to do today is talk a little bit about what are the actual risks of rhinoplasty that I have actually seen or know someone, one of my colleagues, who has had something like that happen. So first of all, any surgery, anytime, risk of bleeding, scarring, and infection. Now with rhinoplasty, risk of bleeding is real, and that is why I require patients to stay at least 2 days after surgery. After the first 48 hours, there is still a risk of bleeding, but that risk goes down pretty significantly. So I do like patients to stay the night after surgery and then one more night, just in case they get a nosebleed. If that happens, I want to be the one to take care of you. I'm the one that knows what happens. I know where to look, and I know, what I can do and what I can't do. So that's why I do think it's really important for patients to stay locally, at least for 2 nights after surgery. Risk of infection, really low. Luckily, the nose is a supravascular structure. Everything in the face is. The nose is supravascular, and so it generally heals really well. Even then, we give you an antibiotic at the before surgery starts in the pre-op area on your way up to surgery. We give an antibiotic through your IV, which minimizes the risk of infections. And then I also put patients on an antibiotic for a few days afterwards just to minimize any risk of infection. Now, if that does happen, obviously we can treat it, but prevention is better than a cure. Other last risk of scarring. That risk is pretty low from rhinoplasty. Even with an open rhinoplasty, usually the only scar is this little one at the columella that generally heals really well. In a lot of my patients, even I have to look to see where that scar was. After like a year, it's pretty much invisible. But if it doesn't heal as well as we want it to, there's a bunch of things we can do. We can do dermabrasion, we can do some little microneedling. I mean, there's things we can do to help smooth that scar. If patients opt to do an alar rim reduction, where we're taking in the alar base a little bit, that also can leave a scar. Again, in those cases, as long as patients take care of it and they use a scar gel routinely, those scars generally heal really well. They hide in the crease, kind of behind the nostril. But again, I always follow my patients. I want to make sure that all scars heal as well as possible. And so if there is any other treatments that need to be done, I do it. It's part of the package. There's no extra cost because I want it to look good too. So some of the risks that are unique to rhinoplasty are, number one, septal perforation. So the septum is the cartilage with two little cartilage and membrane that divides your nose into 2 sides. I often will take a graft from the septum, or if the patient has difficulty breathing, I often will just take the bent cartilage out to help improve their nasal airway and their nasal breathing. That usually heals really well despite having removed like a pretty big piece of cartilage. What happens is basically what used to be a wall becomes a curtain. So there is mucosa, then cartilage, then mucosa. I take out the cartilage from the middle and then sew the 2 mucosal flaps back together. So the nose stays divided into 2 halves, and those mucosal flaps usually heal really well. Rarely there's some kind of a problem where it doesn't heal as well as we want it to. In that case, there can be a little hole in the curtain. That's called the septal perforation. Now, sometimes that is not really obvious and the patients don't notice it at all. Sometimes patients will notice a little whistling or difficulty breathing. If that is the case, it is fixable. I'm one of the surgeons here in town that does septal perforation repair. So it's definitely fixable. But obviously nobody wants to have a second surgery, so I do everything that I can to try and avoid that. The other complication with a rhinoplasty, there are so many variables in how it heals. Of all of the surgeries, all the cosmetic surgeries, rhinoplasty probably has the highest revision rate. The best surgeons in the world, and I go to conferences with people who've been doing this 20, 25 years, even some of the best surgeons have 10 to 15% revision rates. And I think that's because the nose is a complicated structure and there's just a lot of factors that go into how it heals. So probably the biggest risk of a rhinoplasty is a cosmetic deformity. It doesn't quite look the way that you want it to, or doesn't quite heal the way that you want it to. Now, I do recommend, if that's the case, that patients wait a full year for everything to settle, everything to end up the way that it's going to be eventually, because the nose does change a lot in that first year. I have a lot of patients at 6 weeks that are like, oh, I wanted the tip smaller, It gets smaller. So a lot of rhinoplasty is just patience, and kind of like trusting the process. But if at 1 year you're still unhappy with the appearance, I do usually offer a complimentary revision, kind of depending on what the problem is. And again, like, I stick with the patient so that we make sure that we end up with a result that you like. And then last, there's always a risk that we can make the airway a little worse or make breathing worse. Now, I am double board certified in ear, nose, and throat and facial plastics, so I'm always thinking about both form and function. So I want the nose to be beautiful, cute, the way that you want it, but I also want you to be able to breathe through it, and I want this to be a nose that you can breathe through for life. So I'm always thinking about those two things, and I'm always thinking about how those two things interact, both the form and the function of the nose. However, like I said, there can be problems with healing, or something graft doesn't quite stay where we want it to, and there can be a problem with breathing afterwards. Again, these are all fixable problems, but it is important that patients come to their post-op visits, and that we look in the nose as much as we can to just make sure that everything stays the way that we want it to. So those are really the big risks and the big things to think about if you're considering a rhinoplasty.